Today I want to have a conversation with you about something I think is really important, and it's often missed in a typical medical setting, and that's low vitamin D levels. Now, we all know that low vitamin D is associated with poor bone health and things like that, but oftentimes I see a situation where patients come to me with fatigue, mild depression, seasonal affective disorder, poor concentration. They just don't feel like themselves. And one of the easiest things that we often find that we can address is actually a suboptimal vitamin D level. And I've seen it time and time again have a huge impact on a patient's overall sense of vitality and energy when their vitamin D level is normalized or optimized. Have you ever asked your physician if you could check your vitamin D level? They might have said, well, that's not really necessary, or insurance won't cover it. You might have had to beg in order to get a vitamin D level added. And then when the results come in, they might have told you, hey, everything looks normal, you're great. But it's left you wondering, is my vitamin D level really optimal? What is the expected range? Where should I be for my overall health? And that's where functional and integrative medicine often differ from traditional allopathic medical clinics, is we see vitamin D not only just as a nutrient, but actually as more of almost like a hormone that's so critical for so many different areas of the body. It's not just important for bone health, but immune system and functioning, cognition, mood and emotional well-being. So many things vitamin D is absolutely critical for. So let's say you're feeling a little subpar. Maybe your energy is poor, you have trouble concentrating at work, you're a little more irritable with your spouse, your kids, you just don't feel quite right. I'd encourage you to ask your doctor if checking a vitamin D level is appropriate for you. And you just might find that your level is suboptimal and can have a significant impact on their quality of life. Optimal vitamin D levels, most practitioners, myself included, say an optimal vitamin D level is probably at least 50, and 50 to 80, 50 to 90 perhaps is probably the sweet spot. Can you have symptoms with a vitamin D in the 20s or 30s? Absolutely. I see it all the time. And when those patients' vitamin D level is optimized in the 60s, 70s, or 80s, they often feel much, much better. So we all know that vitamin D can come from the sun. Of course, we create vitamin D through our skin, through sun exposure. But I often find that just sun exposure is not enough for most people. And it might be because we cover up when we're outside to avoid sunburns, we put on sunscreen, or we just don't spend enough time in the sun, especially in the winter. And there's also a component of where do you live relative to the sun. If you are further north, the angle or degree of the sun usually isn't strong enough in order to synthesize that vitamin D in our skin. So many people find themselves low in vitamin D, even if they spend ample times outdoors, and they need to supplement in some way. Now, can you get vitamin D through your diet? You can, to some extent, although I see it is typically pretty hard to get a robust vitamin D level through your diet or sunshine alone. Optimal sources of vitamin D might include cremini mushrooms, salmon, things like that. Fortified products can have some vitamin D, like fortified orange juice and things. But again, it's pretty difficult to optimize your vitamin D if you're low just through diet alone. So there's a lot of different supplement options out there, and it can feel overwhelming to know which form, what dose, what company. And so I spend a lot of time with my patients going through the options and talking about reputable sources of vitamin D3 and how to take it properly. Just taking a D3 supplement is helpful, although I typically and almost always recommend it along with vitamin K2. K2 is really important for incorporating that vitamin D into the bones where it's used. Also, K2 is really important for protecting the cardiovascular system, for blood vessels, for arterial health, things like that. So I always recommend D3 with K2, and most supplements these days, you'll find that in a combination already. Now, there's oral capsules, there's liquid. Both can have a time and a place. Capsules are easy to take, usually once a day. Any time of day is great. Liquid can also be great. Some of the liquid vitamin D3 K2 products out there are liposomal, and they're designed for rapid absorption. So I've seen in some patients, they respond much more rapidly to a liquid form of D3 K2 as opposed to a capsule. And not all supplements are created equal, even though it might say it has 5,000 international units on the label. If those supplements were actually tested by a third party, some of them actually perform very poorly. So that's why it's really important to use a clinician grade reputable supplement company rather than just relying on the cheapest supplement you can find at the grocery store. So what's the proper dose of vitamin D3 with K2? Well, it really depends, and that's why checking your level is so important to get a baseline. If someone's vitamin D level is in the 20s versus the teens, their supplement recommendation might be very different. Obviously, you need more the lower you are. It becomes a really personalized and individualized treatment program. And I always recommend test, don't guess. Check your level frequently and adjust your dosage accordingly. For most people, around 2,000 to 5,000 international units of vitamin D3 is probably a pretty safe place to start. I don't recommend any higher than that unless you've had your vitamin D level checked and you've confirmed that you need a higher dose. Now, are there risks of taking too much vitamin D? There certainly are, although it's pretty rare and I actually haven't seen it myself in clinical practice. If you have a supratherapeutic vitamin D level, it can increase calcium absorption, and that can lead to kidney problems and other issues. Again, it's rare and I don't usually see it, but that's why it's so important to test your vitamin D level and titrate your dosage accordingly. Now, when's a great time to optimize your vitamin D level? I always like to check vitamin D levels in the fall as we're leading up to cold and flu season, or ideally a couple of months beforehand, so that if you're found to be low, we have time to replete your vitamin D stores before cold and flu season come along. There's been so many published articles suggesting that low vitamin D actually weakens your immune system and you're more susceptible to viral illness when your vitamin D level is suboptimal. So get ahead of the curve, check your vitamin D level early, make sure it's optimized at least to the level of 50 before the fall comes so you can have a really strong winter. So vitamin D is critical, not just for bone health. Think about it when you're thinking about fatigue, depression, seasonal affective disorder, energy levels, and really importantly, your immune system. Advocate for having your vitamin D level checked. If it's not covered by insurance, consider paying out of pocket. It's usually not that expensive. And work with a functional medicine or integratively minded practitioner who can help guide you and optimize your vitamin D level so that you can have a strong, healthy year to come. I hope you found this conversation useful. I'm Dr. Kate, and thanks for watching.